This video is a continuation of my facelift series. This one is specifically talking about the deep neck lift. So I'm going to talk about when I do it on a patient, how I do it, what are the risks and limitations of the procedure, recovery, etc., specifically regarding the deep neck. I'm going to first talk about when do I do it, and is everyone a candidate? First of all, I do a deep plane facelift in every single patient, and that is discussed in my video, Deep Plane versus SMAS, and I tell you why I do that. But the component that I do in maybe about 50% of my patients is a deep neck lift. And that deep neck lift is specifically meant to debulk the neck when a neck is very full, but in certain other circumstances, I'm also doing it not just for a full neck. So let's talk about when do I do it. The fastest way for me to decide is during a consultation. I take my two hands, I pull back up on the neck, and when I do that, if I see a very crisp 90-degree angle, I pretty much don't need to do a deep neck lift on you. And so even in the saggiest neck, with the crepiest skin, with a lot of platysmal sagging and the turkey gobbler appearance, if I can pull my hands up and I've gotten it close to a right angle, I'm pretty much good, no matter what the age of the patient is. However, when I pull back on the neck and I look there and there's bulge or bulk, then that person really needs some reduction. It's like taking a very fat person with a very tight pants and you're trying to pull that pants tight around it. You're still going to have fat there. You need to reduce the fat, not just pull up on it, because you can't pull everything back up. So there are some patients that are non-negotiables. There are some patients that are, sometimes I'll need it, sometimes I don't. I'm going to talk to you about those cases so you'll see if you are one or not. Of course, the best way to do it is if you're in with a consultation with me, then I will be able to give you a definitive answer in counseling of yes or no. So the absolute non-negotiable yes is a very bulky neck. When you've got a very full neck, no matter if you're young or old, you really need that. And so I've noticed that this really applies to people in their teenage years all the way into their 80s. So it's not really relevant per se to someone's age, because a young person can have a very bulky neck and that person needs a deep neck lift. And you think, well, would they really not need and why would they need a facelift? Well, actually, to qualify one thing, if they're under 40, I will oftentimes just do the deep neck lift and not do the deep plane facelift. So the deep plane facelift is in someone that I need to elevate the tissues and reduce this, elevate the tissues, and the deep neck lift is to debulk the neck. So in someone under 40, I may be doing really just the deep neck lift. In someone over 40, I'll be doing either the deep plane facelift with or without the deep neck, depending on what I see. So when I pull my hands back, if I pull them back and I feel like, oh, there is just too much fullness here, then they really need a deep neck lift. In the person that has a very thin neck on the other end of the spectrum, you would think, well, why would you need to debulk that? And the reason is when I go in there and I feel back in this area, I can sometimes see also a bulge that occurs. So if you've had a facelift where afterwards you just look and you have this bulky circle in your neck, it's because probably the doctor over-thinned out with liposuction, and then, which I almost never do. I don't even do liposuction, and I'll explain to you why in a moment. And then when you elevate those tissues, all you have is this thinned out, bulky neck area where you get this bulge coming out, which is the submandibular gland. So in patients with very bulky necks, I would say absolutely need to do it. In patients with very thin necks, when I pull back and I can see the submandibular gland there, it's really important, in my opinion, to reduce it. The gray zone sits somewhere in between, where the person is, when I pull back, they're not perfect in the neck, it's pretty good, and they say, look, I want to spend a little less cost and not do the deep neck lift, then yeah, I can still get a pretty good result, especially in the jawline. It's still going to be pretty darn clean. Not quite as good as a deep neck lift if they need it, but still oftentimes my patients are very, very happy with that. But it's when I'm dealing with very deep neck structures that I really need to get that neck clean. That's when I would recommend that to debulk that area. So I'm going to talk a little bit about what is involved with a deep neck lift so you understand the mechanics of it. So let me first tell you what it's not. It is not liposuction, okay? So if you think about the platysma muscle in here, the external component of the neck between the skin and the platysma is really fat called subcutaneous fat. Oftentimes we do, oh, that's the waddle, I just got to suction that out. But that fat is very precious because people that do thermage, they do all those types of treatments and they over thin out that area. All you're going to show is the platysmal band. So first you get very little results. So Kybella, liposuction, lipocontouring, microneedle, all those things, they don't do anything. They're not going to give you a much better neck result in terms of elevation. In fact, zero, if anything worse. So you're either going to get minimal gain or no results, or it's going to premature age you, because when you take that precious subcutaneous fat out, those bands are much closer to the skin. And if you have done nothing to modulate those bands, even if you're 40, over time they're going to start to expose themselves earlier by 5 to 10 years. So Kybella is terrible in the neck because either it's going to do nothing, give you a minimal result, but it may predispose you toward earlier aging. I recently saw an esthetician she sent me a photo asking me what I would do. And I go, oh my God, have you had Kybella? She says, how'd you know? I said, because I saw the neck was all raggedy, everything was been taken away, and it's exposed all of those deep tissues. So that cushion on the outside should not be touched. So what am we talking about when we're talking about bulk? Why is it called deep neck? Because underneath this platysma, underneath being inside or superior to it, are all the deep structures that are full. Those are the submandibular glands. Those are the digastric muscles. It's the deep fat. So taking out the deep fat cannot be suctioned out. It must be carved out and reduced that way. If you just do that, though, you're going to have a problem, because reducing the central component of the neck and not doing the glands, which a lot of doctors are too scared to do the glands, why less than 1% of doctors remove glands. When you take out just that deep fat component and not the outside, you get a cobra deformity, where basically it looks like it's all suctioned in here and it doesn't look right, and the outside looks like a bulge, like a cobra. So you don't want to go in and just take out the deep fat. You almost always need to take some of the submandibular gland tissue out as well. So that is the crux of this discussion, is what is the submandibular gland? Is it a problem if you remove it? Are there risks with it? So they're going to hear 4 things online when you Google this, and hopefully don't Google this because you're probably be scared, but I'm going to sort of refute each of these components. So the first thing they're going to talk about with the submandibular gland removal is you're going to have dry mouth. Yes, if you have Sjogren's disease or something extreme dry mouth, maybe I wouldn't do it for you, but in the ENT literature, they've actually reviewed this topic and looked at patients that have had full submandibular gland removals, both sides, and I don't take all the submandibular gland out, and they have not had dry mouth. It's only if they had a cancer and they've actually had a radiation as well, that's when there's risk with it, but they haven't had a problem with that. So dry mouth is something I'm not worried about. The reason is you've got 1,000 to 1,500 minor salivary glands in your mouth. Most of your saliva is from your parotid glands, which are not touched. You've got 2 sublingual glands that are not touched, and your submandibular gland, I'm only taking about 30 to 40% of them out. So dry mouth is not something I'm concerned about. Of course, you're consented for it, but that's one thing that people talk about. The second thing people talk about in terms of risk is that there are nerves there. It's interesting, in about 3% of my patients, I have a temporary nerve issue where their smile may be off for a few weeks to a month or so. I've had a couple last 6 months, never permanent. But believe it or not, never from a submandibular gland removal. The reason is that the submandibular gland excision is done within the capsule of the submandibular capsule, and the nerves sit external to this capsule. I'm not outside that capsule, I'm on the gland. So never had even a temporary nerve issue with the submandibular gland removal, but that is always possible. Never permanent, definitely. So with the removal, it's going to lead to 2 other things you're going to see online: bleeding, major bleeding, and salivary leaks. Fortunately, I've not had either one. I've had a hematoma or bleeding from a normal facelift. I've had a parotid leak doing a facelift, and all of which are temporary and goes away. I've never had one from a submandibular gland, and I do one almost every week. You say, well, why have you not had this? The reason is that with the submandibular gland, it's the technique that I have. I have a device called a Covidian, and the Covidian clamp is amazing because the way I used to do it, unfortunately I never had a leak with that, was using a cautery device and cauterizing it. The problem with the cautery is I could under-cauterize it and then a bleed shows up later, or vessels and spasm, or I could over-cauterize it. So if I over-cauterize it, it gets too charred down and then a char falls off and you can have bleeding afterwards or a leak. The Covidian clamp is a $25,000 instrument that I have that it's absolutely mind-blowingly amazing. And what it does is I seal it. It's an ultrasonic sealing of the gland. So it goes beep, 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 beep. And when that final beep is there, it has a built-in blade that cuts it. And I know that on that other side, that gland is sealed. And so I do this in a very slow, methodical, meticulous, systematic way to clamp that gland and remove it in a way that is appropriate. Now, why am I not worried about over-removing and making the neck too thin? Because that's always a concern that you may hear about as well. But the reason I don't is that I have an endpoint. It's not an arbitrary one. I don't go in there and just try to take the whole gland out. It's not right. What I do is I look at the mandible. I can feel it and see it as I'm dissecting, and I'm looking in there. Remember, the submammary glands sit over here. And what I do is I shave the gland flat to the mandible, because you want a mandibular border that's very flat. So that's my endpoint. It's not more than that. It's not less than that. Is when that gland is right flush to that mandibular border is when I stop. One thing I forgot is, do these glands get bigger over time? They've actually done MRI studies to show that these glands don't get bigger over time. They just sort of descend. And that's really what I'm addressing. And then once I'm done with all that, I've done the glands, I've done some of the deep fat, I go and look, and believe it or not, I get a pretty flat result before I even begin to do the elevation. In fact, I don't start the elevation until I'm happy with the contour of the neck. So sometimes when I'm done with all that, I'm still not happy, and there's still some fullness, and that's the digastric muscle. The digastric muscle is a muscle that really doesn't do a lot, and I'm actually not removing it. I'm just shaving down anything that's bulgy, and that's usually paramedian, meaning the center component is the subplatysmal fat I talked about. The glands are on the sides, and then there's a digastric fullness in the middle. And I use that Covidien clamp to reduce the digastric, so minimizing bleeding. I also use it for the deep fat, so I can get everything contoured with very little risk of bleeding. So contouring that deep structure in that area is using this Covidien clamp allows me to get very, very precise reduction with very minimal risk of bleeding. So that's how much I reduce, how I do it, and I really believe the risks are quite limited. Then after all of that is when I put the platysma back together to the deep structures so that I can do the platysmoplasty, which is part of every deep plane facelift that I'm doing. So essentially, that is the nutshell of how to do a deep neck lift. I do leave a drain still in there. Maybe by the time this video comes out, I will stop leaving a drain in for a week because I don't see anything drain out. I just use it as an insurance policy. But the deep neck lift is great for any age, okay? And I think I misspoke at the very beginning because I thought about it more, and I'm thinking, well, the deep neck lift is great for any age for fullness. And the deep plane facelift is great for anyone over 40 per se, although I do 35 and more. If they have some sag, I'll do the deep plane facelift on them as well. And if someone doesn't have bulk, I'll just do the deep plane facelift. And so these are the components of a rejuvenation. And again, the deep neck can be in almost any age. You could be a teenager and have a very bulky neck. But I ask of you and I beg of you, if you're not going to do this, don't do a liposuction, a Kybella, because if you're young, you'll have some temporary benefit of mild nature, not significant, but it won't lead to much benefit, and it's going to condemn you in the future for an early need for some kind of platysmal work, and I hate that. And if you do it this method, you'll get a really good result no matter your age, and I hope this makes sense about how I do a deep neck lift.